Hello and welcome to the UMCC Medical Consultant Connector, your trusted source for clear, straightforward health information. Today, we're diving into a topic that many people find difficult to talk about, yet it affects millions. We are going to discuss how common medications can impact your sexual health. It is a subject often shrouded in silence, but understanding it is crucial for managing your overall well-being. Your health journey is complex, and treatments that help one part of your body can sometimes have unintended consequences for another. Please take a moment to like this article, subscribe to our channel for more essential health insights, and share this with anyone who might find it useful. Many of us take medication daily to manage chronic conditions, improve our mental health, or prevent pregnancy. These drugs are often life-changing and essential. Antidepressants are incredibly important medications that have helped countless people manage depression and anxiety disorders. The most common class, selective serotonin reuptake inhibitors or SSRIs, works by increasing the levels of serotonin in the brain. Serotonin is a neurotransmitter often called the feel-good chemical because it helps regulate mood, happiness, and well-being. Examples of common SSRIs include fluoxetine, sertraline, and escitalopram. While boosting serotonin is excellent for improving mood, this very same chemical plays a complex role in our sexual response. Unfortunately for many, this can lead to some unwelcome changes in the bedroom. Serotonin has an inhibitory or dampening effect on sexual pathways in the brain. By increasing the amount of serotonin available, these drugs can inadvertently turn down the volume on the signals that control libido and arousal. For both men and women, this can manifest as a significantly lowered sex drive. For men, SSRIs can lead to difficulty achieving or maintaining an erection, and delayed ejaculation where reaching orgasm becomes difficult or even impossible. For women, the effects are just as profound. Many women on SSRIs report decreased vaginal lubrication and difficulty reaching orgasm, a condition called anorgasmia. If you are experiencing these side effects from an antidepressant, it is crucial not to stop your medication abruptly. Your mental health is the priority. The best course of action is to schedule a conversation with your prescribing doctor. There are many potential solutions to explore. Your doctor might suggest adjusting your dosage, switching to a different type of antidepressant like bupropion, which has a lower risk of sexual side effects, or adding another medication to counteract these issues. Managing high blood pressure or hypertension is absolutely critical for preventing serious health events like heart attacks and strokes. The medications used to control it are lifesavers. However, some of the most common types can have a noticeable impact on sexual function. Two major classes of drugs often implicated are diuretics and beta blockers. Diuretics help your body get rid of excess salt and water, which reduces blood volume and lowers blood pressure. For men, adequate blood flow is the fundamental requirement for an erection. Diuretics can reduce the force of blood flow throughout the body, including to the penis, making it more difficult to achieve and sustain an erection. Women are not immune to these effects. Just as blood flow is essential for male erections, it is also crucial for female arousal. This can lead to decreased sensitivity, difficulty becoming aroused, and a general lack of physical pleasure during sexual activity. Hormonal contraceptives, most commonly known as the pill, have revolutionized reproductive freedom for women. These pills typically contain synthetic versions of the hormones estrogen and progestin, working primarily by preventing ovulation. Many combination birth control pills increase the production of a protein called sex hormone binding globulin, or SHBG. This results in lower levels of free, usable testosterone, which can directly translate to a diminished sex drive for some women. If you suspect your medication is affecting your sex life, do not stop taking your pills. Instead, talk to your doctor about your concerns. There are many alternatives, such as ACE inhibitors or ARBs for blood pressure, which have a much lower incidence of sexual side effects. For birth control, you could explore non-hormonal methods such as the copper IUD, condoms, or a diaphragm. The goal is to find a method that meets your reproductive needs without forcing you to sacrifice your sexual well-being. We have seen how medications essential for mental and physical health can carry the potential for sexual side effects. This is not a reason to fear or avoid necessary treatment. Instead, it is a call to be an active, informed participant in your own healthcare. The most powerful tool you have is your voice. When you approach your doctor, be direct and specific about what you are experiencing. Do not be embarrassed. Healthcare professionals discuss these topics every day. It is also important to remember that medication is not always the sole culprit. Stress, relationship dynamics, fatigue, and underlying health conditions can all contribute to sexual difficulties. A holistic approach that considers your mind, body, and relationship is often the most successful path forward. Ultimately, we want you to leave this discussion feeling hopeful and empowered. A sexual side effect from a medication is not a life sentence. In nearly all cases, there are solutions available, but finding them begins with a conversation. Be your own best advocate. Pay attention to your body, trust your instincts, and never hesitate to speak up. Your well-being matters, and that includes your sexual health. Thank you for joining us at the UMCC Medical Consultant Connector. Take care of yourself and know that help is always available when you reach out for it.